Hi everybody, we're gonna get you back to the stream that you're watching right now in just a second. I wanted to sit down real quick and tell you guys kind of what you're raising funds for. This is Mike Vance, who's with Behavioral Health with Children's Hospital and Medical Center, and we're gonna kind of sit and talk about this really cool VR setup that you guys have, that through the assistance of the funding that you guys receive from all our viewers and Extra Lifers out there in the community. So start with the basics real quick. What does it do? What do you guys use it for?
Well, most of the people in the audience probably have at least heard of, if not seen, virtual reality. And we use it predominantly for an exposure strategy. So if we broke the groups of kids down that have benefited most from it, there would first of all be the group of kids that have specific anxieties. Maybe that's a social anxiety, maybe an anxiety of a fear of needle injections or of going into an MRI. And within inside of the virtual reality system, we can have the child truly experience that event and talk them through it to help them use their coping strategies. So there's a lot of different fears and phobias. In Nebraska, one of the large ones is storms. And storms can be pretty debilitating, especially with all the way the Weather Channel inundates us. And we have real life examples with the flooding. So we have a number of kids that we've been able to take through a progression from a slight breeze up to almost a Category 5 hurricane to really increase their comfort, and great success stories with that. Another group of kids that we work with is kids that are having trouble controlling their impulses, in particular anger. And the virtual reality gives us a great number of opportunities to help kids demonstrate self-control by taking them through exposures and experiences. And then along with the medical procedures too is an area where we're getting more and more utilization out of the virtual reality concept. We can actually place a child in what would experience to be an MRI with complete sounds and visions. And I tell you, I'm not a good MRI person. It really feels like you're in the MRI. And we can then determine, is this kid going to be able to manage it? This patient going to be able to manage that? Or are we going to need to help them in another way? And it's amazing the confidence that it can instill.
In terms of tech, we obviously see the VR headset here. Mm-hmm. Is there a computer that drives it, or is it all just built into the headset?
It's a great question. We have a variety. So we have one device that we use that's really useful in the hospital because it'll allow us to immediately clean the unit, and it has individualized pads for each child. And that one is actually driven out of a cell phone that's completely shut down and dedicated to that unit. That's a device we use there. On some of our more elaborate phobia exposures, we actually have two screens hooked up to a high processing game-like computer. Couldn't use the desktop that I use. We'd have to go up to the game level.
Sure.
Just to get that true picture and to not have any of the lag. And the cool thing about having two screens is the therapist can then see exactly what the patient is experiencing in their goggles in real time. So you can take them through the experience, and you can actually, on some of them, you can actually control the intensity from outside the unit.
Okay.
So it's very simple tech when you're using it, but I'm sure behind the scenes, not being a programmer myself,
Sure.
I'm sure it's pretty complicated.
About how much of a success rate do you see with it? Is it pretty common that it's have a child come in and you say, oh, they have a needle phobia? Is it pretty common that you can get them past that, or is it?
Yeah, it's a really important part of the total exposure package. We don't just use virtual reality. You could, and early studies from some other universities and hospital settings have shown that they can reduce the amount of sedation that kids need to be under, reduce the amount of restraints kids need to go under, which are wins for everybody. It saves money. Sure. And it saves kids having to be sedated. We combine it with our regular psychology, behavioral therapies, and it just provides a different medium to expose that. For example, some of our patients, in particular with eating disorders, struggle relaxing. So we can put them in the virtual reality meditation world And it's much easier to teach them meditation when they've got a vision in front of them than if they're just having to create that vision in their head.
So in terms of, we're sitting here talking about this tech, in terms of the funding that you receive from Extra Life and other various outlets, what all does that go towards when it comes to this VR setup?
It's a great question. First of all, let me summarize it that it's essential and it's very helpful because we don't bill for this service, so we don't have direct revenue, so that it is, and it is not, it's innovative enough that they're not giving it away.
Sure.
So, and if you think of the 6 or 7 different examples I gave of where we can use this, we've got 3 or 4 different types of VR machines that we use to do that. Some of them are quite expensive, some of them are a little more reasonable. And without the Extra Life funding, we could not have that breadth of impact. We would be impacting far fewer kids, and we'd have to pick. We'd have to say, okay, well, this one, because one of the devices we use is really good for distraction and really good for MRI exposure. But that would be all you'd be able to use it for. And so it's essential. Our patients and staff are hugely thankful.
Well, we appreciate everything that you guys do, and I personally appreciate your time, and thank you so much for sitting down with me, and we'll send it back to the stream. Thanks for watching, everybody.
Thank you.